Hey, future nurses. If alcohol use disorder shows up on your exam, and it will, here's exactly what you need to know to crush those questions. First things first, let's define important terminologies. Intoxication. This is referring to the physical and behavioral changes resulting from the excessive consumption of substances like alcohol, which is known as drunkenness. Alcohol addiction, also known as alcohol use disorder, or AUD, or alcoholism, is a chronic relapsing brain disease characterized by the compulsive seeking and use of alcohol, despite its harmful consequences that go along with it. Abstinence syndrome or withdrawal is a set of symptoms that can occur when a person discontinues the consumption of a substance. Like our example, alcohol. When alcohol is no longer present in the central nervous system, it becomes overreactive, leading to the withdrawal symptoms. Remember that alcohol is a deadly abstinence, so you need to use medication and the proper treatment when discontinuing or becoming abstinent from alcohol. These effects will occur about 4 to 12 hours after the last consumption or your last drink, and may continue to be experiences until 5 days to a week, and it is divided into 2 phases. Phase 1 is early withdrawal. This is 6 to 24 hours after the last drink. This phase usually involves mild to moderate symptoms as the body begins to react to the absence of alcohol. Common symptoms in this phase include central nervous system disorders such as anxiety, agitation, restlessness, insomnia, or that difficult to sleep, headaches, irritability, mood swings, mild tremors, often in the hands. Know that one. GI symptoms can be the nausea, vomiting, and loss of appetite. And then your autonomic nervous system, sweating, rapid heart rate, or your tachycardia, your increased blood pressure, which can become severe, heart palpitations, and dilated pupils. If withdrawal progresses and is more severe, symptoms from phase 1 can intensify, and now more serious symptoms may emerge. This is the phase 2. This typically lasts 24 to 72 hours after the last drink. This is the phase that carries the highest risks. Symptoms can include medical emergencies. These symptoms include, again, the CNS, worsening anxiety and agitation, confusion, delirium, like hallucinations, visual, auditory, or tactile, seeing, hearing, and feeling things that aren't there. Your seizures, your generalized tonic-clonic are the most common, and disorientation. Autonomically, we can have increased heart rate and blood pressure, fever, heavy sweating, alcohol withdrawal delirium that we were talking about. This is the most severe form of alcohol withdrawal and can occur in this phase 48 to 72 hours, but even later. It is a medical emergency, and it is characterized by severe confusion and disorientation, agitation, hallucinations. So, as nurses, for treatment and management, we should always assess and monitor vital signs. Ask when the last drink was to figure out if they could be possibly in phase 1 or phase 2. Step 2, we're going to medicate them. We can use benzodiazepines, diazepam, lorazepam. This is to calm the overexcited neurons to prevent seizures. If too much benzos were administered, flumazenol is the antidote. Disulfiram antabuse. This creates nasty reactions if alcohol were to be consumed, like vomiting, palpitations, or even shock. Advise patients to avoid all alcoholic sources. Mouthwash, hand sanitizer, cooking wine. This can cause contraindications and life-threatening problems. This has to be in conjunction with some type of therapy or 12-step program. Naltrexone. It blocks the feel-good effects from alcohol and makes it less pleasurable. You should take it with meals because it can upset the patient's stomach. Acamprosate. This eases withdrawal discomfort but causes diarrhea, so make sure to encourage fluids as necessary. This is taken 3 times a day with meals and not ever to be given to pregnant women. Lastly, we have our clonidine and beta blockers. These are mostly our adjunct pharmaceuticals because of, again, that we're looking for palpitations, tachycardia, and severe hypertension.
Thanks for watching. If you found this video useful, don't forget to like, share, and subscribe for more medical information, and to really help you on your next exam.